Welcome everyone, and thanks for coming to our clinic online info session. My name is Jacqueline Ranett, and I'm the Marketing and Communications Coordinator at the Boucher Clinic and the Canadian College of Naturopathic Medicine, Boucher campus in New Westminster, BC. So it is my, right here, great pleasure to introduce today's speaker, naturopathic doctor Shabita Teja. Dr. Teja is a licensed ND and pharmacist in BC. She is the owner of the Sinclair Wellness Centre in downtown Vancouver, a multidisciplinary clinic offering registered massage therapy, acupuncture, traditional Chinese medicine, chiropractic, naturopathic, and osteopathic care, as well as athletic therapy. Born and raised in the Lower Mainland, Dr. Teja graduated from the University of British Columbia with a degree in pharmaceutical sciences and received her training as a naturopathic doctor at Boucher. She is passionate about facilitating her patients' healing by getting to the root cause of their condition and accompanying them along their health journey. Everyone, please welcome Dr. Teja.
Thank you so much, Jacqueline. It's a pleasure to be with all of you tonight. Thank you for taking time out of your busy schedules on this Tuesday evening. And like Jacqueline said, the presentation will probably run about an hour or just under, and then we'll leave the rest of the time for questions. Last time I presented, just over a year ago, I did answer any questions that we didn't get to via email, and Jacqueline shared those. So rest assured that your questions will get answered. So let's get started. I'm just going to start the presentation here. And I'd like to thank Boucher for having me today. I am an alumni at Boucher, so I spent a lot of time, longer than the 4 years that it normally takes, and I will get into that a little bit later. So as Jacqueline said, I'm Dr. Shabita Teja. That's sort of my background. I went to the university. It was actually University College of the Fraser Valley back when I went, but it's UFV now. Just did a year of sciences, then went to UBC Pharmacy, Pharmaceutical Sciences faculty, and then the Boucher Institute. And I'm actually presenting from Sinclair Wellness Centre right now. So after a day of clinic, I'm excited to join all of you. So this looks like a traditional background, right? An educational background, but this is more along the lines of what actually happened to me personally. It wasn't a linear path. Most of our journeys aren't linear. I was diagnosed with inflammatory bowel disease. My specific diagnosis was ulcerative colitis. In the IBD category, there is Crohn's disease and ulcerative colitis, and I was fortunate enough, quote unquote, to be diagnosed with UC. And it was a pretty aggressive form, so I actually took an extra year to graduate from UBC Pharmacy because I had multiple surgeries during that time. One of them was to remove my colon completely. The other was, so I lived with an ileostomy bag for a number of years. And then during the 5 years it took me to complete pharmaceutical sciences, I actually converted my small intestine into what is known as a J pouch. So it functions as both a small and large intestine. My gallbladder is also removed. I went into naturopathic medicine and started having chronic pain as a result of basically nerve damage during the gallbladder surgery. And so today I have a spinal cord stimulator. It took years to diagnose this type of chronic pain, but the diagnosis is central sensitization. And so I have a stimulator in my spinal cord to help distract my brain from the pain that it feels on a daily basis. And then there's fertility treatments. But I come to you today not only with a fur baby, but pregnant at the moment. So I'm very thankful because last year at this time, I was undergoing a number of fertility treatments. So all of this to say that none of our paths are linear. And I have a passion for this medicine because I truly can empathize with the patients that sit across my desk. or during the pandemic across the screen on a telehealth call, because I truly do get it and understand how difficult it is to deal with challenging medical conditions and navigating the conventional medical system. So what we'll cover today is an overview of naturopathic medicine and its treatment principles. I think it's really important to get a background, because I'm not coming at this as a medical doctor. I don't have an MD after my name. I have an ND. And you'll see why I love this medicine so much, because it is rooted in the historical treatment principles of this type of medicine. And hopefully, if you see a naturopath or are thinking of seeing a naturopath, we'll go into a little bit about what you can expect, as well as what you can expect specifically if you go to the Boucher Clinic, which is a student-run clinic. We're going to cover today the impact of stress on the gut. It is called the gut-brain connection, or gut instinct. And we want to learn about what the gut-brain microbiome connection actually is. What is that, what is that conversation about? What is the microbiome? It's definitely a hot topic and a buzzword nowadays, but what is the connection between the gut brain and the microbiome? And then we'll give some, tangible steps on what you can do today to help heal the gut. So whether it's for you or you're listening for a family member or a friend, we'll talk about 3 things you can do to help have a healthy bowel movement, and what a healthy bowel movement should even look like. A lot of my patients, I'm educating on a daily basis as to what a healthy bowel movement should even look like, because they think that what they're experiencing is healthy or normal, and it very often is not. So you'll get to learn about that today, as well as the 4 R's, or often more appropriately, it's the 5 R's of gut healing. You'll learn all about this later. And then, like I said, tangible steps that you can implement today. So, and if there, like we mentioned at the beginning, at the top, if there are any questions, then simply relay those to Jacqueline and we will get those answered. So what is a naturopathic doctor? An ND is a naturopathic doctor, or the other approved title is naturopathic physician. You need to complete a full-time 4-year program, including approximately 4,800 hours of classroom training and 1,200 hours of hands-on training. You need to be fully licensed and insured and regulated by the College of Naturopathic Physicians of BC, or CNPBC. So, of course, I am regulated and insured. And if there are any additional certifications, for example, I have my prescribing authority and IV certification, acupuncture certification. These are all additional certifications that need to be applied for. So just because you've completed, the close to 6,000 hours of training does not allow you the right to practice additional modalities. So keep that in mind if you are visiting a naturopath or seeing a new naturopathic doctor for the first time. So if you were to come to the Boucher Clinic, for example, what can you expect from a first visit? So typically there are student intern physicians that are working with a naturopathic physician that is fully licensed, who is supervising and will oversee the entire case. I remember when I was at Boucher, you would do a couple of semesters as a secondary a secondary student intern is what I want to say. And that is typically done in 3rd year, and then 4th year, you're primary. So you're more running the show. The secondary kind of sits in the background and is a fly on the wall. So there are at times up to 3 clinicians in the room with you. But they're very thorough in reviewing your entire case, including identifying your personal health goals during that initial intake, which can be an hour. Typically, even if you see a naturopath out in practice, out in the community rather, those initial intakes are at a minimum an hour. And that's the benefit of seeing a naturopath. we get into a lot more detail because we have the time in order to do that. And then subsequent visits can include physical exams, lab testing, and then various modalities like acupuncture, IV therapy is available at the clinic, whatever they deem necessary as part of your treatment plan. And they work with your medical team, provide evidence-based medicine that's natural in its approach, but everything is signed off by that supervising naturopath, every treatment. So, but the students are really, researching and learning up-to-date information, up-to-date treatment modalities, treatment ideas. So you really are getting, exemplary care, in my opinion. And then they provide individualized medicine, just as any naturopath does, targeting the whole person, and then ensuring that each person is given safe and effective treatment, obviously. So when we're talking about treating the whole person, that is actually one of the treatment principles of naturopathic medicine. And this is what I was talking about at the beginning. What is naturopathic medicine? What are its treatment principles? So just like a medical doctor, first do no harm. That's obviously very self-explanatory and kind of common sense. But we want to, as a society of naturopathic doctors, really get to the root cause of that patient's symptoms or condition, disorder. We don't want to simply put a Band-Aid approach onto it. So for example, if you have a headache, instead of prescribing Tylenol, or Advil, which might be indicated, we would ask as a naturopath, what is causing the headache? What is the root cause? Let's look at the whole person. And that's where treating the whole person comes into play, rather than compartmentalizing system by system, which often happens when you see a specialist. That is their thing, that they know that system very well, and it can be very helpful at the time. But as a naturopath, we're looking at the whole person. We also have a principle called doctor as teacher, because we want to educate patients so that they can empower themselves to take active steps in their own health, and even work towards prevention. So let's look at your blood work results and not just look at those numbers that are out of reference ranges, but which numbers are close, which numbers are getting there, what can we flag and get to a point of prevention rather than treating symptoms after the fact. And then the healing power of nature, that's really important in naturopathic medicine. We're using, the inherent wisdom of plants when we're using herbs, even supplements. I mean, supplements basically are made up of herbs and or vitamins and or minerals. So we're using the inherent power of nature to heal. I often put this triangle called the healing triangle in front of every new patient that sits across from me or, on the other end of a video call. I will show this because it is a very important part of our medicine. It is, again, showing treating the whole person, not just the physical symptoms, but what is going on mentally for the patient, what is going on emotionally for the patient, socially for the patient. And in the middle of that triangle is what's known as the center of gravity. So ideally, we're all balanced. Everything is in perfect harmony, but 99.9% of us do not exist in perfect harmony at any one point. And that's why we're seeking the help of a medical doctor or a naturopathic doctor. So where is that center of gravity being pulled? If there is some sort of gut disturbance, that is more in the physical realm. But as I am going through that 60-minute intake form, I'm learning more. Say, for example, this patient has a history of depression and anxiety. Well, there's a pull then in the mental emotional plane. This is what's causing the off balance of this particular person's healing triangle. And how can I, as a naturopath, treat this individual patient with individualized medicine so their particular treatment plan is not applicable to another person, because this is just for them. And that is, I think, what Hippocrates was getting at when this quote Or he said, it is more important to know what sort of person has a disease than to know what sort of disease a person has. So really getting to the root of what that person is dealing with, rather than just applying a slap happy treatment algorithm to, say, a patient with ulcerative colitis, and let them ride the hierarchy or climb the treatment ladder one rung at a time. Our medicine is more about treating me, Shabita, as someone that has ulcerative colitis. What is going on in my life? Am I a type A personality? Am I stressed out all the time? Is my gut taking the beating because of my mental emotional symptoms, for example? So that is what, this slide and the healing triangle is all about. And really how I bring that patient back to an equilibrium, balancing their center of gravity, is using the treatment principles of naturopathic medicine, but working from the least invasive to most invasive. And that's what this naturopathic therapeutic order is all about. So you've seen a lot of triangles today, a lot of pyramids, but really they're all kind of building one on top of the other to give you a broader sense, a broader overview of what naturopathic medicine really is. So I will always tell my patients that at the end of a 60-minute visit, I will give you an idea of what my treatment recommendations are, but I always move from least to most invasive in terms of modalities. So maybe we're starting off with lifestyle, diet changes. My prescription, the number one thing on my prescription could be increasing water, and that would be a number one treatment recommendation. And then moving into things like herbs, supplements, homeopathics. Maybe then we're going into acupuncture, then moving into chiropractic manipulations, and then kind of the final rung of the ladder would be IV therapy or even medications if that naturopathic doctor has prescribing rights or not. So really, that's what this little box is about. So food first and always, herbs often, supplements sometimes, and medications only when needed. That's sort of the mentality or the thought process behind naturopathic medicine. So let's get into, now that we've talked about and given an overview of what naturopathic medicine is, its treatment principles. Today, we're really going to be talking about two bothersome or chief complaints that I often see in patients, and they go hand in hand, as you'll see, because we're talking about the gut-brain connection. We're talking about stress and digestion. And these are, topics or areas that I talk about often with patients because it's what's coming through the door time and time again. So what is your chief complaint or most bothersome symptom? That is something that on every intake form you'll find. That is something that I'll ask right at the beginning of a visit. So if we're dealing with the topic of stress, I would ask on a scale of 1 to 10, how stressed are you, to give me some context, right? 10 being the most amount of stress that you've ever experienced. Maybe this patient is going through a divorce or has lost a loved one. Or is moving, the top 3 stressful things that supposedly could happen in life. Where are they on that scale? Are they at a 2 or 3, or are they at a 7 or 8, given a relative 10 out of 10 diagnosis? So I always give them what that 10 out of 10 would be to give some context. And then what are your biggest stressors? So as the patient, what stresses you out the most? Is it work? Is it family, relationship, finances, or is it your health? Oftentimes it's a lot about, well, I've tried this, this, and this. I've gone to this, this, and this doctor. They're not spending enough time with me, or I've seen specialist after specialist. And now it's not only taking up time, it's taking up finances. I've seen another practitioner, and shelled out hundreds of dollars, and I'm still dealing with the same chief complaint, the same bothersome symptoms. So sometimes our own health can be a stress enough or a stressor enough. So we all have these laundry lists of things to do, never-ending lists of things to do, and now we're exposed to stress kind of on a low grade but constant level, Whereas before, if you look at, in a historical context, or even now on the plains of Africa, if you see this gazelle running from a lion, their stress is only short term. So this gazelle is springing into action. It is into this rapid response referred to as fight or flight, where the sympathetic nervous system, so the autonomic nervous system, or the ANS, is split into two branches: a sympathetic nervous system, or fight or flight, that's that rapid response, or the parasympathetic nervous system, often called rest and digest mode. That's where you're hitting the brakes. So we're springing into action. This gazelle is running away from the lion, but their fight or flight mode, where their heart rate is increasing, their blood pressure is increasing, blood flow is shunting away from the gut, away from the core, into the limbs so that it's able to run away, is very short-lived. It's intense, but it's short-lived. Then they go into rest and digest. And if you have a pet, or, like my fur baby Brule, I often will see him shake completely. And that is his way of moving from fight or flight into rest and digest. So it's an interesting thing to note if you ever see your own, pet dog or animal do that. They have ways of moving from that rapid response into hitting the brakes. But our stress response wasn't designed to be on all the time. It was meant to get rest between stressors and go back into equilibrium. And so too much gas on that pedal, too much fight or flight for too long will cause discomfort and disease. Because if you think about it, if you're always in sympathetic mode, if you're always in fight or flight, there is no blood flow going towards your gut, because historically that's what fight or flight is meant for. You're meant to be running away from your predator. So everything is in the limbs, nothing is through the core. There is no blood flow. Where there is no blood flow, there is no healing. There's no helper hormones. Nothing is getting directed to the core, essentially. So there is a big impact on the autonomic nervous system. And interestingly enough, now research is showing that not only overt stressors, so say, for example, like we mentioned, the top 3 stressful things, if you're moving, death of a loved one, or a divorce, not only those overt stressors will impact our nervous system, but it's the negative thoughts or our covert thoughts that communicate with the autonomic nervous system and cause just as much damage. So often the brain and mind can be thought of as one, not in this case. The mind is powerful, and the brain simply follows the program that is set out by our mind. So if your mind is your best friend and your advocate, you've got healthy thought patterns in your head, which, let's be honest, a lot of us don't. There's a lot of negative self-talk that's going on in the mind. But if it happens to be your best friend and advocate, you are more resilient, or you tend to be more resilient. But if your mind is sabotaging you with core beliefs of, say, fear or alienation, rejection, it can and does often become your biggest enemy. So the takeaway here is to make sure, or just let this be a little warning or thought process to say, controlling your mind is very important, because it can either help you or hinder you. It can positively affect your thoughts, and you can better regulate your autonomic nervous system response. And things like, meditation, staying connected or conscious to our thoughts, having self-awareness, we are able to better control those thoughts, which ultimately have an impact on our gut health, believe it or not, because of the fight or flight rapid response versus rest and digest, which is hitting the brakes. So the other area that we are talking about besides stress is digestion. So in this area of, the chief complaint or most bothersome symptom, I will ask about their bowel movements. I'll ask Where are you eating your meals? Because if you're rushing and you're on the go, oftentimes we're not fully digesting our food. And when we're not fully digesting our food, that can show up in the form of an unhealthy bowel movement, especially when you're in fight or flight mode. As I mentioned before, there is no blood flow going to your central organs, to your gut, to your intestinal walls. And so that has a definite impact. So if you're, just trying to make it to a meeting and you're scarfing down your lunch, well, you're scarfing down your lunch in fight or flight mode. So how much do you think is actually getting digested? How much do you think is actually getting absorbed? Well, it's very, very close to a minimal amount. Let's look at the stool chart that I actually put in front of patients when I'm asking these types of questions, because it's all relative again, just like stress, right? 0 to 10, what does that mean? A 9 could be completely different for one person versus a 2. We have to put it into context. So putting your stools, your bowel movements into context, the Bristol stool chart is absolutely the way to go. Type 3 and 4 really are what is considered normal. So you want it to be kind of, looks like a banana shaped or a sausage, brown colored, but there should be no blood. There should be no mucus, no undigested food in there, because we want it fully digested. If ultimately we're in rest and digest mode, we're calm and we're having a meal, we should be able to recruit all of our digestive enzymes and resources to fully digest that meal, have it be absorbed by the small intestine, have the nutrients be absorbed, and then eliminate waste without having food appear in the stool. But I mean, I just had a patient today that thought that their bowel movements were completely normal. I pulled out this chart like I typically do, and guess which type this patient said that they had, and multiple bowel movements just in the morning, all type 6 and 7. And initially they had said that, oh no, I don't have diarrhea. Diarrhea is not what I have. I mean, it's not formed, but it's not loose either. You pull out the chart and you learn a wealth of information about this particular case, and it helps me see and put into context what is going on in the brain for this patient. And we're going to talk about that, because is there a connection between the gut and the brain? Absolutely. Do I see highly anxious, stressed out patients with also type 1 and 2 stools who say bowel movements are very rare for them unless they plan to be in a completely stress-free environment? So they have to plan out a quiet time in the morning where they can go and have their bowel movement. And even then, it's not easy to pass. And it's they have to strain a lot. So there is definitely a connection. And that connection is the gut-brain connection. So this is basically the highway that exists between your gut and your brain. And that highway or collection of nerves is called the vagus nerve. It's actually the longest nerve in the body, runs directly in front of us here. And what's interesting to note is that scientists, so evidence-based medicine, research papers, what's coming out is that, and this is, years ago that this was figured out, that 20% of the vagus nerves are sending information from the brain into the stomach, but 80% of these nerve fibers in the vagus nerve are actually sending information from the gut to the brain. So the majority of the information actually is communication between the gut and the brain, which is very interesting to note, because oftentimes we thought that it was just a one-way highway, but it's actually a two-way highway. So there are over 100 million neurons. Your probiotic bacteria and the compounds that they produce actually interact with the neurons in your gut, and they'll send signals to the brain up the vagus nerve. So the gut microbiome is also really important, and that's the connection here between we talked about the gut-brain axis, but we also have hundreds of trillions of bacteria that also interact between the gut, and then they interact with the brain. So sorry, I just lost my place here. So in here, the writing is really hard to see or small, but on the right-hand side, the comment that was just made, under a brain of its own, it says the enteric nervous system is located in the gut and is often referred to as a second brain. So that is absolutely 100% right. There are, so when we think about probiotics, these are the good bacteria. Those are present in the gut. And now a lot of studies are showing patients with depression, patients with anxiety. Yes. Sorry?
Yes, actually, you can get gut depression, actually.
Yeah, exactly. So, that's what I was just going to say, that those patients tend to have, that's okay, tend to lack these strains of probiotic bacteria. And so it's shown in clinical trials time and time again, those suffering with depression tend to not have the good bacteria or these positive strains. Same thing with anxiety. So, the term "go with your gut feeling" really goes a long way here, because we actually have 95% of the body's serotonin, or the happy hormone, stored in the gut. So when I have patients in front of me with mood disorders, with anxiety, with depression, even just, their mind is always racing, something has changed in their mental outlook, in their mental health, the gut is actually a really important place to start for this very reason. Let's clean up the gut and then see the impact on your mental health. And I'm not saying that that's the only thing. If you remember back to the naturopathic therapeutic order, we are moving from least to most invasive. So this is just one of many treatments, but let's treat the person as a whole rather than simply just giving an antidepressant or an anti-anxiety, which can be seen as a Band-Aid approach, but is necessary for some patients. So we want to look at all systems. So this gut bacteria is also key in other systems, including the immune system, including the neuroendocrine system. So we actually have something called gut-associated lymphoid tissue, or GALT, that is present. So this is immune tissue that is just in the gut. So can you imagine what happens when there is some, disorder in the gut, some compromise to blood flow in the gut? It is impacting now your immune system. And in, the day and age of COVID, all of my patients want to know, how can I improve and support my immune system? Well, the gut plays an important role in that as well. Any sort of any sort of disorder or condition of the gut can derail your immune system and actually promote inflammation. There are also area of the gut that simply metabolizes estrogen. So female patients that come to me and have an imbalance in their hormones, the gut is also being treated, again, as a part of multiple organ systems, but the gut is included in that. So we've talked a little bit about what your bowel movement tells you about your health. We looked at the Bristol stool chart, but as I promised at the beginning, I was going to give tangible tips on how to have a healthy bowel movement. So now these tips should make sense. The first one is diaphragmatic breathing to activate the vagus nerve. So if you remember, the vagus nerve is the highway that connects the gut to the brain. It is two ways, so it also connects the brain to the gut. How you can activate it is diaphragmatic breathing. And the reason is because it runs from the brain directly in front of us to the intestinal wall. So when we take a deep belly breath, that really essentially is what a diaphragmatic breath is, or what diaphragmatic breathing is. We are physically triggering or activating the vagus nerve. And in doing so, we get to move into rest and digest, because the vagus nerve is intimately connected to the parasympathetic nervous system. Remember that branch from the ANS, or autonomic nervous system. So as soon as you take a deep belly breath, maybe take 5, we are activating the vagus nerve to get us into rest and digest mode. And that helps have a healthy bowel movement, because now blood flow is being shunted back into our core, back to the intestinal wall, and aiding in full and complete nutrient digestion and absorption. So things like, not eating on the go, chewing your food thoroughly, all of that will also play a role in having a healthy bowel movement, especially if you have a lot of undigested food in the stool. I'll have some patients tell me that, oh yeah, I see basically everything I ate. So pieces of kale or rice or quinoa. I mean, corn is one thing. Okay, I should put the caveat of corn. Corn can be difficult to digest for most of us. But beyond that, and beets, yes, will turn your stool pink or red, so don't be alarmed. But beyond those 2 caveats, we really shouldn't have undigested food. The other tip is drinking water. That's, pretty much a no-brainer, but I would say about 85% of my patients are dehydrated. 85% easily will come to me and say, oh yeah, I have 2 cups of water a day. I'm, that's no problem. Let's move on. And I say, no, 2 cups a day for your height and build is not enough. It's not enough for anyone. I mean, we all should be having that minimum 8 to 10 glasses. And if you are such a person right now and you're listening and thinking, yeah, I guess I only have 1 or 2 cups of water, you can build up slowly, half a cup, increasing by half a cup to a cup per day, so that your kidneys and urinary system get time to adjust, and you don't spend the next couple of days in the running to and from the bathroom. But you do need to increase your water, hydrate your cells, and improve your digestion. It is recommended to have room temperature water. And the reason is that so it's not a shock to the system. So for example, if you have really icy cold water, the body is going to take time warming that water up, and that is recruiting energy that could be directed towards digestion. So that was something interesting that I have made note of. It does have its roots in Ayurvedic medicine, which is Indian-based medicine. So that is something to note. And not drinking with your meals. So drink before or drink after, but not during, because you are essentially diluting your body's own digestive enzymes. And that's important. And you'll see that when we talk about the 4 or 5 R's of gut healing, that our digestive enzymes are very important, and we have enough, but sometimes you do need to supplement with some if, for example, you are drinking water during a meal and diluting all of yours, because then they're no good to anyone. So not during meals. And then the third tip, or what a healthy bowel movement really should look like, is regular elimination, daily bowel movement. So that's something that often patients will be alarmed at hearing, that they thought going once every 2 to 3 days was considered quote unquote healthy. And it's not. We want to eliminate regularly. We want to detoxify regularly. Our bowel movements are really waste, essentially. They are. So we don't want to carry that around. We want to eliminate regularly, and 1 to 3 per day. So if you're eliminating and having a healthy bowel movement after each meal, that is fine and considered healthy, as long as it's type 3 or 4 on the Bristol Stools chart, like a half a banana or sausage shaped. It is easy to pass. It's formed. And again, there's no blood or mucus or undigested food in the stool. Okay, so that's the tips for a healthy bowel movement and what that should even look like. So now moving into the 4 R's to heal the gut, or the 5 R's to heal the gut. This is kind of a general overview, but we're going to be looking at number 1 and talking about it in a little bit more detail. The first R is removing irritants. So is there a connection between the foods we eat and how we feel? And the answer is yes. There can be things like toxins, pathogens, drugs, infections, stress, as we have talked about the last 40 minutes here. All of that will impact gut health. All of that can, especially stress, can impact inflammation. But the foods we eat actually can impact not only our digestion, but the lining of the gut, the gastrointestinal tract itself, causing inflammation and causing something called leaky gut syndrome. So if you look at this next slide, if we are digesting our food, this is the lining of our gastrointestinal tract. So on the left-hand side is what it should look like. Normal tight junctions. Those are what is basically gluing each cell together. There shouldn't be space in between each cell. Inflammation that comes from things like food sensitivities, and we're going to get into that, but foods that we're eating that don't suit us or our immune system, from stress, from bacteria, viruses, fungi, medications, pathogens, the environment, toxins that we, I'm in a busy city right now, so walking outside, maybe those toxins don't suit me. They are going to help cause me to move from the left side of this diagram to the right side. So my cells then will become leaky and inflamed. And why does that matter? That matters because food particles then, instead of sitting and getting digested within the cell lining of the gastrointestinal tract, it actually seeps in between these leaky and inflamed, poor tight junctions. And they get into our bloodstream. So you can see that progression from the intestinal mucosal cells into the bloodstream. And they trigger our immune system, because the immune system recognizes these as not our own or non-self. What is going on? What is in our bloodstream right now? There's some sort of complex in here. And obviously this food is chemically digested. It's not whole food particles, but even chemically digested, the immune system picks that up. And it can lead to things like inflammation, autoimmunity, malabsorption, and nutrient deficiency. So basically, it can not only just affect our gut, so gas, bloating, abdominal pain, it can actually cause head to toe symptoms. So things like joint pain, fatigue, or brain fog, weight gain, headaches, eczema, and low mood. And low mood I highlighted because that, again, is that gut-brain connection. Why would low mood be something that's even in a conversation about gut health? Well, because of this very reason, because it's circulating, those immune complexes are circulating throughout our entire bloodstream and getting picked up by our immune system and triggering a full systemic, also known as full body response. So the report here that is on the right-hand side of your screen is something called a food sensitivity test. This is an example of the results of a food sensitivity test. So these are not allergies, but if I go back 2 slides, and at the top, I wonder if you can see, but the top is food particles. So what are the particular foods that my immune system is reacting to? How do I know what foods my immune system is reacting to? Unless I do something called an elimination diet, where I take out everything but the main, the non-triggers, so basic foods, and then slowly add in one food at a time, separating by a few days and being really conscious, really intuitive as to what my body is doing in those 3 days. That takes a very long time, but some patients do opt for this option. The other option is running a food sensitivity test, where I take a little vial of your blood, send it away. A couple weeks later, we get a report saying this is what showed up as elevated, borderline, or normal foods. The elevated and borderline are the foods that are triggered by the immune system. So for example, in this patient, egg white, baker's yeast, celery, pistachio are just some of the foods that their immune system is reacting to. What I would do with this patient is, for a minimum of 3 months, eliminate the elevated and borderline foods to give gut rest so that they're no longer triggers to the immune system, and implement a gut healing program, which are the 5 or 4 R's to gut healing. And this is really the, the 5 R's, and you'll see the last R in a minute here. So in addition to removing those foods, which is the first R, we want to remove anything that's irritating the gut. So for that particular patient, it would be, like I mentioned, the elevated and borderline foods. The second R is replacing any missing digestive elements. So maybe this is digestive enzymes. Maybe this patient is still experiencing undigested food in their stool, even though they are not drinking water with meals and doing all the right things, but maybe they don't have enough digestive enzymes. Maybe they don't have enough acidity, which actually in an acidic environment, your digestive enzymes are activated. So perhaps they need a little bit of apple cider vinegar at the beginning of their day to trigger or activate their body's own digestive enzymes, or supplement. So we're replacing any missing digestive elements. So those are some examples. The third R is re-inoculating the gut microbiome with good bacteria. So this basically is introducing into your system probiotics, or the good bacteria, the good biotics, so that we correct that imbalance of good and bad bacteria. Very often there is, in a dysbiotic patient, an imbalance where the bad bacteria outweigh the good bacteria. So we want to re-inoculate. We want to do this slowly. And there is often a period called die-off, where if you go too fast, too much, too soon, patients will get worse before they get better. So be very careful and make sure you have a conversation with your naturopath about exactly what type of probiotic they're recommending, when you should be taking it, how much, for how long. Okay, that's very important. Especially for certain conditions, and one of them being small intestinal bacterial overgrowth, or SIBO, where the bacteria have actually moved from the large intestine where they should be into the small intestine where they shouldn't be. But I could do a whole lecture, and I think Boucher has had other speakers talk just about SIBO for the entire hour. So that's a topic in and of itself, but just to make a note of that. And there are tons of probiotics on the market today, the ones that need refrigeration, the ones that are shelf stable. If you turn that bottle around and look at the different strains, there are tons of different strains, different potencies. So this is where a naturopathic doctor can help you decide what strains are important for your particular individualized case. Remember, we talked at the beginning, this is individualized medicine. So one probiotic might not work for your friend, but it might work for you. The fourth R is repairing intestinal cells. So this is the gut lining that we saw in leaky gut syndrome, either here or here. But we want to move from the right side of the screen where it's leaky and inflamed to the left side of the screen where the cells are tightly knit again. And how we get in there and actually heal those cells are by using supplements. One particular amino acid is called L-glutamine, which actually gets right to the gut lining because it is made or it is part of the gut lining. And so you can supplement with that in the time that you have, that you're removing your food sensitivities, for example. So to heal that gut lining. Also, what do you think is making each cell that is lining the gastrointestinal tract? Well, omega-3 fatty acids. So there is a phospholipid bilayer around the cell membrane, or part of the cell membrane rather, and omega-3 fatty acids are part and parcel of that. So that's another way that you can actually repair the physical intestinal cells. And then the fifth R is rebalance, relax, rest, but we need to do some sort of stress management, often called vitamin R. The fifth R is about getting to that place of rest, relaxation, and rebalance. The woman on the right-hand side of your screen is clasping or touching both her chest and her belly to make sure that her belly is rising so that she is getting a diaphragmatic or deep belly breath. Because as you remember, that is what triggers the vagus nerve to get us into rest and digest, which is very important. So that is the fifth R. And how patients can do this on a broader level is just general stress management. I mean, all of us shouldn't be like that gazelle being chased after a lion, but we all nowadays have this chronic low-grade stress that's just never ending. We have things to do upon things to do. Our mind never stops. So how do we fix that? Well, there's a couple things that can be done. So adrenal function, asking your naturopath about how your adrenal function is. That is your cortisol levels. If we go back to, I won't take you all the way back to the slide, but on that page where I had the list of things to do, there was also cortisol, or a graph of cortisol levels throughout the day. So in the morning, your cortisol should be high. Cortisol is your stress hormone that's released from your adrenal glands, which are located on top of your kidneys. It should be high, so you have enough get up and go. You've got enough energy to get through your day. Cortisol levels slowly decline during the day, come down to a low level at night so that you're able to fall asleep and stay asleep. If you're the type of person that your mind is always active and you can't shut it off, chances are your cortisol levels are dysregulated and potentially can be elevated at night when they should be low. But you can get this tested. So how you maintain regular stress management, regular adrenal function without going into adrenal fatigue, where you're fatiguing the adrenal gland and cortisol is just being produced all the time. Well, consistent scheduling is key. The adrenal glands love consistent scheduling. They love regular exercise, not too strenuous or excessive, but regular, waking up at the same time, going to bed at the same time, sleeping before 10 or 11 p.m., waking up around 6 or 7, just some regularity in scheduling. Deep belly breathing, we've talked about a number of times now, but that also goes hand in hand with a grounding practice like meditation or yoga. We all, this is not new information for a lot of us. Gratitude, I found that adding the Grateful app into my phone, setting notifications can actually be helpful for me to, as a reminder when it goes off, trigger me to say, okay, maybe I should do my deep belly breathing now, just 5, take a few minutes, just a few minutes for myself. And it'll even trigger you with a question. What are you grateful for today? Or what made you laugh today? And I found that it doesn't necessarily help in the moment when I am dealing with a lot, but when I go back, because they keep all the answers to my questions, and I look back and say, oh yeah, my dog Brule really made me laugh that day, or I'm so grateful for figuring out this patient's case, or being able to physically make it into the clinic if I'm having a flare-up of my own body pain. So it just triggers you back into gratitude, and which can be very grounding in and of itself. Time in nature. I mean, there's report or evidence-based medicine, trial after trial that shows being out in nature, forest bathing. I mean, that was a key trial that showed that has a big impact on our mental health. We spend 93% of our lives indoors. You've heard that term, sitting is the new smoking. Get outdoors, it's summertime, be in nature, surround those, absorb those positive ions. Boundaries, I find often women in my practice, they have never ending to-do lists, and they wear endless hats. They're trying to be everything to everyone. You need to make sure that you yourself are being taken care of, and to put yourself, as Shirley Weir is part of Menopause Chicks, who I've done some public speaking for as well. She uses a great term saying, put yourself at the top of the to-do list. That is what needs to happen. And then you can take care of everyone else. But you yourself need to be number one on your to-do list and at the top. And loneliness. So staggering fact, negative implications on health, being lonely, is equivalent to smoking 15 cigarettes per day. That's just crazy to me. And actually, millennials and Gen X, or Gen Z, I believe, the one that comes after millennials, whatever that is, they were actually polled and shown to be the loneliest out of all three generations. So, I mean, we should be more connected than ever with social media, but I think it's actually having an opposite effect. And we are connected, but actually not physically connected with a lot of us. And the pandemic certainly hasn't helped. So, now with restrictions lifting, reaching out, or even if it is over Zoom or over a phone call, connecting with loved ones, and finding what you're grateful for sometimes can come from talking with a friend or talking with a family member, and seeing that it's not all about you and your issues. Other people have, their own issues as well, their own things to do list. As a pharmacist, I always put this slide in just because I find this is very important. Your health, your voice, the importance of advocacy. Please make sure that you are telling all of your practitioners what allergies you have, what medications you're on, what over-the-counter meds you're on, any supplements, herbs. You can also keep track yourself if you're not sure, of various symptoms. Diet, for example, keep a diet diary. Write as much as you can down or have it in your phone. Bring it to each visit with you, because I've been in multiple, as you've seen from the earlier slides, you can imagine I've seen a lot of doctors and a lot of specialists, and the appointments go very quickly. And if you don't ask your questions in that moment, you're out the door and you're not going to see them for another 6 weeks minimum. That's on a good rotation. So make sure when it's written or when you pull your phone out and you tell them at the beginning that I have a list of questions and I'd like to go through these, chances are it's a little bit harder to deny you as a patient. So advocate for yourself. But that cheat sheet is very important, whether you have it in your phone. There are places now that you can download a template and carry it in your wallet or wherever it is, because I've seen this happen time and time again where drug-herb interactions, drug-drug interactions, drug-food interactions are picked up because patients are communicating with each practitioner. Because maybe you're telling your medical doctor one thing, but then your naturopath, you weren't able to get in, or they didn't ask you about your allergies. So make sure that, you are advocating for yourself on multiple levels to save yourself and to make sure that each treatment is truly safe and effective. And as always, just before incorporating any changes to your treatment regimen, I am not your doctor, obviously, so always check with your medical doctor, healthcare provider, naturopath to ensure any new treatment. So even including lifestyle measures, diet, supplement, medication changes are safe and effective for you. So please make note of that. And then just finally, the healing triangle, once again, health is a state of body, wellness is a state of being. And that truly spoke to me, as do the principles of naturopathic medicine, and both go hand in hand here, where wellness truly is not just about the body. It's about not only our physical being, but our mental, spiritual, social, emotional bodies as well. We're all of those things put together, and we should be treated as such, as a comprehensive being, not just compartmentalized. So I will end with that. We're just at about 50, just exactly an hour. So thank you so much for your time, and I will take any questions now.
Actually, maybe I'll go to the chat first. So our first question is from Ravi. My friend, who is a doctor, recommended that I use Restoralax laxative and Senokot laxative to heal my constipate. I have one bowel movement every other day. Do you agree with her advice?
So great question, but I tend not to like to give my own opinion if it's just like an individualized case, but I can talk about laxative use and constipation in general. So say, for example, like you said, you have one bowel movement every other day. Are you implementing the gut healing principles that we talked about? Are you removing food irritants? Are you replacing, missing digestive elements? Have you tried things like apple cider vinegar or digestive enzymes? So have you done the 4 or 5 R's of gut healing? If you've done all of that and you're still not experiencing relief, then yes, of course, you can use something like a Restore Lax, which is a bulk laxative. It's just adding bulk to your stool, or a Senecot. It seems like he's recommending both together because Senecot is more of a stimulant laxative to actually help get the gut moving along. So there's added bulk and then there's movement to help having a bowel movement. But I will say that, again, as I can speak as both a pharmacist and a naturopath, so putting on my pharmacist hat now, those are short-term fixes. It's not something that, I know a lot of people do use it long-term, but you shouldn't be using it long-term because, again, it's a Band-Aid approach. We need to be fixing the root cause of what your constipation is, like what is causing the constipation. So I agree with her advice in terms of if you've tried everything else and are desperate to have a bowel movement, of course, you need to use what you need to use in acute situations. And I agree with that with all types of medications in various forms in acute settings. But long-term, there should be a way to help correct and treat the root cause of the constipation. I hope that answered your question.
What do you think of Align Probiotic?
What do I think of Align Probiotic? I'm just looking at. Yeah, so Align Probiotic is suitable. It is on the scale of, how shall I say this? On the scale of potency of probiotics, it's on the lower potent side of things. So what I mean by that is probiotics are grouped in terms of, probiotic potency is grouped in terms of colony forming units, or CFUs. So say, for example, you're having fermented foods versus a probiotic supplement. Fermented foods like a yogurt, kefir, kombucha, sauerkraut, even sourdough bread, they'll be kind of in the range of maybe 5 to 20 billion CFUs, or colony forming units. I have inflammatory bowel disease patients, such as those that have ulcerative colitis or Crohn's. Some of my patients are on 300 to 450 billion colony forming units, same dose, same directions, for example, let's just say. So you can see the difference in potency. Now, maybe Align Probiotic works well for you. It's got a few strains. It doesn't have, a laundry list of strains that might be applicable. Like I mentioned in the presentation, a probiotic that works for your friend might not work for you because different strains correspond to different conditions or disease states. And I can send, Jacqueline, there's probably a 15-page table that has the different conditions and which strains are applicable for that condition based on evidence-based medicine. So that if that's of interest to you, that can maybe be shared. But in general, yeah, Align Probiotic is a place to start, but it might not be the be-all and end-all for your particular case.
Thank you. Alicia asks, what are your thoughts on using colon hydrotherapy for bowel dysfunction with the exception of Crohn's, UC, CA, etc., or etc.?
Okay, yeah. So with the exception of inflammatory bowel disease, and I'm assuming CA for like colon cancer, colon hydrotherapy, again, individualized basis. Some of my patients love it and, practice that on a semi-regular basis. I will just put a caution out there that in doing hydrotherapy, make sure you go to, experienced practitioner, because what we don't want to happen is to have very chronic use of colon hydrotherapy where then we're wiping out your good bacteria, right? Because that can also happen. Similar to with an antibiotic, antibiotics will kill the bad bacteria for sure, but it also kill the good bacteria. So all in moderation, but yes, in some instances, it can be helpful.
Great, thank you. Alicia asks, what about using prebiotic fiber with probiotics?
Yeah, great question. So the prebiotic actually feeds the probiotic bacteria. And now the new hot thing is postbiotic metabolites. So there is a lot of new research and information coming up, but prebiotics, yes, can be helpful to kind of complete or begin that loop and feed the probiotics so that the probiotics themselves have food. Jerusalem artichoke is a great prebiotic. So a lot of fibrous foods. Inulin is another one. You do want to be careful with things like, and I mentioned this in the presentation, but with things like small intestinal bacterial overgrowth, because in that situation, the bacteria that should be in the large intestine, again, as I mentioned, moves into the small intestine. And so what we don't want to happen is just to put in more probiotics, prebiotics, and have the body then be overcrowded and result in things like die-off, where as the bacteria, both good and bad, are dying off, you're getting a lot of bloating, a lot of gas, a lot of abdominal pain and discomfort. So this, again, if whatever you're taking, whether it be prebiotic or probiotic or both, it should be checked by especially a naturopath or someone that knows what they're talking about and can help you in your individualized case. But yes, in general, in most cases, it can be helpful.
Thank you. Marianne asks, how long should you avoid drinking water before, after meals?
Oh yeah, good question. So I had mentioned not to drink during the meal. Usually I kind of earmark it with half an hour is good enough. So before, half an hour before you have a meal, half an hour after should be fine.
Hi, thank you. I'm not sure if you can hear me.
I can hear you. Yeah.
Okay, thank you. Thank you, Shabita, for all the information that you have given us to us. It has very explained very clearly, a lot of issues. My question is, what probiotics are recommended for someone with candida?
Good question. So with candida, what tends to happen is, this is a yeast overgrowth, right? So candida is a negative yeast in certain environments and can trigger a lot of discomfort for patients, a lot of abdominal pain, bloating. So what really has to happen prior to you starting the probiotic is a candida elimination regimen. So you have to clear out the candida before introducing the good bacteria, because what's going to happen is similar to SIBO, where you'll get the die-off reaction. You're just going to overcrowd and overcrowd. So good and bad bacteria, good yeast, bad yeast, good bacteria, bad bacteria will all fight and compete for space. And you'll be the loser in that situation because you'll be the one that has the gas and bloating and abdominal pain. So candida elimination programs or regimens are very strict, quite difficult, but it can be done. Again, under naturopathic supervision, you want to change your diet, stay away from sugar, stay away from other yeasts, use herbs and supplements, things like garlic or oregano oil, caprylic acid. There's now supplements that have all of the therapeutic herbs inside of them. And so, but this is an individualized basis. Again, I feel like I'm saying that ad nauseum, but you have to get treated yourself individually to say what is the right supplement or program for you. Once it's been cleared, then you can introduce something like a probiotic to help repopulate the gut.
Thank you.
Yeah, you're welcome.
Great, excellent. I have a question from Louisa. She asks, is it best to avoid prebiotics with microscopic colitis?
Okay, so a good question. Microscopic colitis is a very specific type of collagenous colitis. It's actually refers to two different or two related rather medical conditions: collagenous colitis and lymphocytic colitis, where there's a overgrowth of lymphocytes or white blood cells. So it is a very specific type of colitis. I would actually ask your gastroenterologist, because this is one of those small but important areas of specialized medicine that a prebiotic might be okay in one person's case, but might not be okay in another. So I would have to know about severity and other medications you're currently on, ones that you've tried before, because often things like steroids are used in these cases, and we just want to make sure that there are no interactions. So unfortunately, this is more of a individualized case.
Great, thank you. I have a question here from Adriano. I would like to ask about the sensitivity food test. I did the test 2 years ago, and I heard that the body can be changed, but I do not know how efficient this test is. What is your advice time by time to do this, and if this information is true? Sorry if I didn't answer your question properly, Adriano.
So about the food sensitivity test, you did it 2 years ago. You heard that the body can change, and you don't know how efficient it is. So I'm just reading it again. Are you advised time by time to do, and if this information is true? So again, I'm not sure if I understand the question correctly, but if you're asking about whether food sensitivity tests results can change time to time, the answer is yes. So if you did the test 2 years ago, your results could be very different than when you do the test now. And that is because your immune system changes, what foods your immune system is picking up as elevated or borderline, so things that are causing a reaction, can be very different, even 6 months apart. So yeah, I have patients that come in and will bring old food sensitivity tests to me, and that is no longer, unfortunately, applicable. So if they hadn't done the proper gut healing and elimination at that time, it's almost like you are starting from square one again.
Adriana, go ahead.
Thank you so much. Really appreciate always the information. I have one disease, HIV, and I have some problem in my stomach, and I have a lot of depression. And until now, any doctors or anybody said to me about this, you information us are about the good for the stomach, and I'm not sure about how can be treat me, because I take always the 5 steps you teach us, and still have some problems in my stomach.
Sorry, so you've done all 5 steps and you still have issues?
Yes.
Okay, so you've when you had the food sensitivity done 2 years ago, you completed the full gut healing protocol?
No. Maybe that's the problem.
That's the
I
problem.
didn't. Yeah.
That's a problem then. Yeah. So
Okay.
what I would do is, if you're able to get a food sensitivity test done, again, I know you gave me a little bit about your case, but please take it as general advice and not specific, because you do need to be treated, especially someone with your medical conditions needs to be, I would suggest, treated by a medical doctor, a naturopath, and a specialist. Like, you need to have a team working together for your care. But in general, I will say that it is best to do the food sensitivity test and then do the gut healing protocol within the same 3 to 6 month period.
Okay, thank you so much.
Yeah, you're welcome. Good luck to you, Adriano.
Great. So Claudia asks, is Miralax then not good to take on a regular basis to regulate constipation?
Oh yeah, so I mean, Miralax or Restoralax, I mean, I think it's two names that are referring to the same thing. So yeah, if you actually look on the label and on the drug information, under, I think it's cautions or contraindications or warnings, it will say do not take for longer than 7 days. So it itself as a product is not recommending that you take it for a long-term duration on a regular basis. Like I said earlier, at the start of the Q&A period, you can take it in an acute situation, meaning you've got constipation, you've tried everything and it's really uncomfortable. Yes, take it in that moment, even if you have to take it day 1, day 2, day 3. But I mean, if it's longer than a week, then we're missing something here. It's because clearly it's not working. And we have to get to what your root cause is as to what's causing the constipation. And maybe it's not just the gastrointestinal system that we have to look at. Like I mentioned in the presentation, maybe it's multiple systems that the gut affects that we need to also look at and treat the whole person. So they're typically, even on its own label, it'll say do not take for longer than 7 days.
Excellent. Are there any foods, for example, dairy or gluten, that you recommend all of your patients avoid?
Sorry, I was just looking at the, sorry, can you repeat the question? I was just looking at the other question.
Sure. Are there any foods, for example, dairy or gluten, that you recommend all of your patients avoid?
Oh, good question. Yeah, so on my slide on that first, the 4 R's page, there's a picture of a recipe book that is a dairy-free, gluten-free book. So yeah, I do recommend, I mean, I should say this. If you are doing an elimination diet, which I mentioned was the other option for food sensitivity, instead of doing the food sensitivity test, because some patients can't afford that, don't like getting poked, whatever there's always pros and cons to each. And I always give patients the option of either or. So if you choose the elimination challenge diet, you know, a number of foods are going to be eliminated, including dairy and gluten, because those are 2 of the top offenders that a lot of people have sensitivities to. Now, remember that this is not an allergy. This is not something that you have to be off of unless you're celiac, then you would be off of gluten for life. But most patients have to just remove those food groups, including dairy and gluten, for a short period of time, heal the gut, and then try to introduce dairy first, then gluten. So 1 at a time, whatever the case may be, and see whether you're getting the same symptoms back again. But in general, like, there are no foods that I'll say that all of my patients must avoid. Because again, it's a case-by-case basis. I'm just thinking, yeah, of course I'll tell, you know, all of my patients that they shouldn't be smoking, they shouldn't be using recreational drugs. Those would be like a clear no. But with foods, it is hard to say absolutely do not have this food group, period. I mean, sugar we know is quite damaging. It is very difficult to eliminate, but that is a big one. So in addition to dairy and gluten, there would also be sugar, like I mentioned, yeast, alcohol, ideally, but I know that that's difficult. And so in the inflammatory category, there's something called nightshade vegetables. So vegetables you think, yeah, they're super healthy, everybody should eat them, but nightshade vegetables in particular tend to be inflammatory to some patients, especially those that have inflammatory disorders. So sometimes removing those particular vegetables like eggplants, tomatoes, that can be helpful for patients. So again, case by case basis, I hate to keep repeating that, but there's no hard and fast rules.
Great, thank you. We have a couple more minutes left and a few more questions.
Okay.
Is belly fat a symptom of an unhealthy gut?
Oh, good question. I would say not necessarily, but bloating. So if your belt is, you can't buckle it all the way and it's not necessarily fat, but bloating, gas and bloating are big concerns for an unhealthy gut. Belly fat in general tends to be more cardiovascular or a cardiovascular concern, I should say, in general, because what's happening is that fat is actually surrounding your organs, your really key organs in that area. So fat around the belly, fat around the middle, that adipose tissue or fat tissue tends to be the most damaging, the most concerning for health reasons, especially cardiovascular health. But if you can differentiate between if it's belly fat or actual bloating, and I've seen time and time again this happen with patients where it's actually bloating, that is a cause for not concern, but something that you should, get checked out and not just think that, oh, this is normal, I have to live with it. I get gas and bloating towards the end of the day. Nope, there's something going on that's not a normal symptom. So get your gut checked out.
Great, and I think we'll answer one more question. What is the cause of polyps in the large intestine? Is it related to an unhealthy gut?
Polyps can be from, it can be from an unhealthy gut. Yes, usually it's a collection of inflammation that has led to that polyp. Sometimes polyps can be polyps or diverticuli, basically outpouchings in the large intestine that can have bacteria caught inside of it, food particles or waste like stool, and then that can lead to things like diverticulitis, which is an inflammation of those outpouchings. So in the case of diverticuli in particular, which is outpouchings, like I mentioned, lack of fiber is a big one, dehydration. So you're not drinking enough water, don't have enough fiber in the diet. So it does, yes, it goes back to an unhealthy gut, but I mean, that's a broad category, but it can be one of those specific R's in the gut healing protocol that you in particular haven't addressed. So yeah, I think cleaning up the gut can definitely improve multiple disease states and conditions.
Great, and we just have one more question, if you don't mind answering it. Is chlorophyll helpful for constipation?
Chlorophyll. I haven't actually heard of that being used as a targeted treatment for constipation, but I am going to say that if you guys know that are still left on the call, the 21 of you that are left, that whole medical medium celery juice fad that was out there. I had a few patients that swore that every time they had celery juice in the morning, those days their bowel movements were stellar. And there's no rhyme or reason for it. Maybe it's the increase in fiber, but if you're juicing, you would think that there is no fiber in there, just the raw juice. So sometimes one particular thing can be helpful for, like I said, a probiotic can be helpful for your friend, but not for you. Maybe chlorophyll will work for you. It is a innocuous or, very less likely to be harmful, chlorophyll, when used. So it is something that, again, make sure that medical disclaimer, that you run it by a medical professional before you try it, even if it is a pharmacist. If you're getting it from a natural pharmacy, that you make sure some medical professional knows what other supplements, herbs, drugs you're on before trying it. But but it's not listed as one of the, the typical treatments for constipation, no. But it is a very powerful antioxidant. So it, shouldn't do anything but help, but please make sure that you're getting it checked by a medical professional.
Great, excellent. Before we go, I want to thank Dr. Teja for her wonderful, well-explained presentation, and for all of you attending our webinar. Please expect a follow-up email with today's recording in your inbox before the end of the week. If you are interested in learning more about the Boucher Clinic or booking an appointment with us, please visit our website, boucherclinic.org, or call us at 604-540-2873, also on the website. And if you are interested in learning about the CCNM Boucher Campus Doctor of Naturopathic Medicine program, please visit binm.org or join our info session next week. Link is in the chat. Have a great rest of your evening, everyone.
Thank you so much.
Thank
Have
you.
a great evening, guys. And if you want to reach me directly, you can always go to tejawellness.ca and you'll get my direct email. So if you have any other questions, feel free to reach out. It was a pleasure spending time with you guys. Thank you so much, Boucher. And thank you so much, Jacqueline, for organizing all of this and for getting me ready for the presentation from a technical standpoint too. Thank you, everyone. Bye now.